What about, this one is gross. Salmon sperm injections. Have you heard of this?
Everybody, I'm Lori Schulweiss.
And I'm Jen Giammo.
And welcome to another episode of Everybody Talks, the podcast where we explore the wide world of wellness. Sometimes we talk to experts, sometimes we just talk to each other, but we're always talking to you. And don't forget, you can watch this episode on our YouTube channel at Everybody Talks Podcast.
Every week, we discuss topics from nutrition and exercise to mindfulness and self-care. And today we are talking to a board-certified medical and cosmetic dermatologist with an integrative approach to skincare that focuses on the whole patient, blending conventional dermatology and medicine with holistic principles and natural remedies.
She specializes in integrative aesthetics and food as medicine, combining advanced testing, personalized skincare, and lifestyle changes to create a holistic, results-driven approach to help patients feel and look their best from the inside out. She's created a science-backed, personalized process that identifies root cause, which we love, and treats the whole person, not just symptoms. She's here to tell us more about that and much more. Please welcome to Everybody Talks, Dr. Asmi Berry. Welcome to Everybody Talks. How are you?
Thank you. So excited to be here.
We're excited to have you. We kind of always start, we gave you a big, long intro, but why don't you tell us a little bit about yourself, how you ended up in cosmetic dermatology?
And I wish that you could do virtual Botox or something for me right now.
One day.
Okay.
Yes.
Yeah. So as I was going through medical school, I was always drawn to dermatology. I'm a problem solver. So I love the idea of seeing something on the skin and then putting together the pieces of the puzzle to figure out what was going on. And the creative and aesthetics part of dermatology is always so exciting. But I would say the biggest draw is I recognized our skin, which is our body's largest organ, is a barometer for what's going on internally. So I did my dermatology residency. I moved to New York City and I started working at a celebrity cosmetic boutique practice. And I loved it. But then I started realizing my medical dermatology patients, they would keep coming back with the same issues. So they'd come in, I'd diagnose what they had, and then I would give them a treatment and it would work. But then a year later, they'd come back with the same issues. So that's when I realized traditional dermatology is missing something big. And that's when I decided to go back and get advanced training in integrative dermatology, where I learned how to take a functional whole person approach to dermatology conditions. And then I went to Ayurvedic culinary nutrition training, where I learned how to take an Eastern approach to healing and how to use food as medicine. And now I'm here in Los Angeles, and I'm helping my patients optimize their skin with modern aesthetics, nutritional counseling, and root cause testing. And what's really beautiful is my patients are starting to see that when you treat skin from the inside out, you not only look better, but you also feel better.
Absolutely.
Totally.
Yeah. I wanted to talk about that. I wanted to talk about sort of, you mentioned like the connection between, what we put in our bodies reflects on our skin from the outside. So that gut skin axis, right, is kind of a big part of skin health that I think people don't really think about. Can you talk to us a little bit about like how gut health directly influences like any of these skin conditions that we tend to see, like acne or eczema, rosacea, things like that, and what dietary adjustments can people make to help with that?
Yeah, definitely. So these skin conditions that you mentioned, among others, like even premature aging, there is something going on in the gut. So let's take acne. Research has found that people with acne compared to people who don't have acne have more of the bad bacteria in our gut versus and less of the good bacteria. And we're seeing what's funny is historically people with acne were treated with long courses of antibiotics, which helps with the kind of inflammation bacterial piece, but it does lead to gut dysbiosis, affecting our gut microbiome, which, as we know, can worsen acne. So gut is really important in acne. And then in terms of diet, when you eat foods that are high in glycemic index, meaning they turn into sugar quicker in your blood, or whey protein or dairy, all three of these things leads to an increase in insulin and insulin-like growth factor 1 in your bloodstream. And what these hormones do is tell your pores, let's make more sebum and let's increase inflammation in the body. And as we know, both of those can lead to acne. And then in terms of eczema, what's going on in the gut is there's an impaired gut barrier. So this allows allergens and other inflammatory molecules to pass the gut barrier and get into the bloodstream, leading to a hyperactive immune response. Um, and in terms of diet for eczema, we have seen, and I tell my patients who are children and have bad eczema to take a specific probiotic. It's the Lactobacillus rhamnosus GG. Research has found that this can help repair that gut barrier. And then with rosacea, there's a strong correlation with a condition called SIBO, which is small intestinal bacterial overgrowth, and rosacea. And we found that treating SIBO will actually resolve your rosacea symptoms. So it's pretty cool.
Wow. You know, it's funny. I developed eczema as an adult, and it's funny to me that like I didn't have it as a kid, but then I've developed all of these allergies, and I'm working with an allergist slash immunologist slash something else to figure out what, but it took me a long time to find the doctor, but I've never been, I would be interested to maybe try that supplement that you're saying.
Yeah.
I mean, she gave me Dupixent, which I see an ad for every other second on television, and I've just started it, and I already see a difference in my skin, but I never made the connection with the things that I was eating.
That you were
Nobody's ever
eating.
said that to me,
Yeah, there's a handful of supplements beyond
Yeah.
that for eczema. Like taking a tablespoon of hemp seed oil can help.
Oh, wow.
Drinking oolong tea. They did a study and they found people with severe eczema who drank 3 cups of oolong tea saw a significant difference that
Wow.
medications couldn't give them.
Oh my
you should
God.
try
I
that.
should try
And
that.
then also there's a supplement called L-histidine that also
Okay.
can help repair the skin barrier, which
Wow.
is the issue in eczema. So
Huh.
there's all things you can try.
Yeah,
That's
interesting.
incredible, yeah.
That's to me, like I would much rather do that than take these drugs.
I know.
I don't know. That's just my.
I know.
If you can heal
Yeah,
with
if you could heal
food
with
or
food.
all
Yeah.
natural,
Yeah.
But so talk to us also. So as well, at least for me, as I'm aging, obviously my skin is changing. Hormonal changes are kind of not my friend right now. And those fluctuations, during these different stages of life, what are there certain things that you can do in your diet to support like hormone balance, so to speak, and mitigate some of these skin issues? I mean, I know obviously wrinkles are one thing, but also just like dryness. I have like very, very
my
dry
gosh.
skin, which I never had before, and like these little patches that they're starting to pop up. And I think it's hormonal, but talk to us a little bit about that.
So the first thing you mentioned, wrinkles. So eating foods that will help support collagen production. So number one is protein. You should always be getting, I would say 1.5 grams per kilogram of protein in your diet. And then foods that are rich in vitamin C. And then for the kind of dryness, you want to focus on healthy fats. So as you get like older and you start having more hormonal changes, you want to decrease the amount of carbohydrates and increase the amount of fats to kind of help with that dry, inflamed skin. So healthy fats, foods that are high in omega-3 fatty acids like fatty fish or walnuts, flax seeds, chia seeds, that type of thing.
Okay. Should I be slathering them on my face? Because I do eat those, and maybe I need to like
That's funny.
pump it up a little bit more. But What about, so we talked a little bit in your intro about, this idea of personalized nutrition and functional medicine, and how, people tailor their diet now to these different skin concerns. Are there tests? Is there any kind of testing that can be done to kind of guide this approach, whether it's dermatology or gut health? But are there like biomarkers or tests that specifically can help you to determine like what patients actually need?
Yeah, so I would say I have like four categories of tests. The first is looking at gut health and inflammation. So there are certain biomarkers that you can measure in your bloodstream that can tell you if you do have an impaired gut barrier. And then also gut microbiome testing. As we're getting more and more data and research, we're being able to understand the results a lot better. The second category is nutritional deficiencies. This is huge. And it can make a really big difference. So I had a patient who came in and she was suffering from hair loss. And she said, I've been taking massive doses of biotin and minoxidil, but nothing's happening. So biotin, it's kind of a marketing gimmick. You won't grow hair taking biotin supplements unless you're biotin deficient, um,
Huh.
which unfortunately is not what the marketing and hype is telling you. So with her, we did nutrient testing, and we found she was severely low in vitamin D, which unfortunately is very common. So we gave her a high dose of vitamin D supplements, and three, 4 months later, she's so happy. Her hair was growing back, and she didn't need to use the minoxidil or the expensive, overpriced biotin hair
Sure.
supplements.
Yeah.
Anymore. Wow.
Yeah.
Because, yeah, I would think too that like that's interesting though, that
Yeah.
having a deficiency is the only way that will really help. But I also think like it could help to maybe strengthen your existing hair, but not to actually grow hair. I don't know.
Right.
At least with some of the supplements
Yeah.
I've taken, I've tried like Nutrafol and
Yeah.
uh, Viviscal was another one, because I was losing
Yeah.
hair too. Like as I started,
Really?
yeah, like
Wow.
in getting into
Yeah.
perimenopause.
Mm.
Even still now, like I get like clumps of hair come out in the shower. I don't know if that's
Wow.
because my hair is so processed, so it's got so much bleach in it, or
Wow.
if that's a result of like these hormonal shifts. This is something that I know you want to talk about.
Yeah. And actually has been brought to my attention.
It's
So
been brought to your
I'm on
attention.
a GLP-1.
Okay.
I've been taking Zepbound for, I don't know, 8 months or so. I've
Almost
lost a
a
lot
year.
of weight. My stepmother looked at me and she was like, "Oh my God, your face is like, you need filler. Oh my God."
Ozempic
And so,
face.
I
Ozempic
mean, I
face.
totally have that. I mean, and it's weird to think that you've lost all this weight. You're happy you did, but now your face is not,
How you
yeah,
want it to look, or how it
exactly,
looked before. Yeah.
exactly. And so,
Yeah,
why don't you
talk to
talk
us.
about that?
Yeah, about
And
like the volume loss. What
Yeah.
causes that, and how
yeah,
can she prevent that from
yeah,
happening?
Yeah, so GLP-1s have really changed the game. A lot of people are losing a lot of weight that
yeah,
they struggled to do previously. So it's a great medicine, but yeah, it can lead to Ozempic face. And the reason why is if you lose a significant amount of weight in a short time frame, what happens is the subcutaneous fat pads in our face, which like hold everything up, they start to shrink. And so this leads to increased skin laxity and that kind of like gaunt facial appearance. So the way to prevent this is to kind of monitor your weight loss. You don't want to be losing more than like 2 pounds a week, because otherwise this could definitely happen. And you want to be again making sure you're eating a lot of protein. So 1.5 kilograms grams per kilogram of body weight. And then for skincare, things that will help boost collagen and support collagen, peptides, retinoids, growth factors, and procedures will also make a big difference. So and fillers used strategically. So a lot of fillers of the past have been used to just kind of like puff up the cheeks or puff up the lips, and it gives you kind of this unnatural appearance. which we don't want. So using fillers strategically right where we know the fat pads are shrinking will help support the collagen and help support the face in the way the fat pads did. So you'd still look like you, but just pre Ozempic bringing down the volume of the fat.
Like, it seems counterintuitive that you've lost all this weight and now you're putting filler in your face.
Well, yeah.
It's like, wait a minute.
So Dr. Berry, does Ozempic actually like interrupt collagen production? Is there anything to that, or is it just the weight loss?
Yeah, so when I see my patients, and this is kind of like a widespread, everybody sees this, skin becomes thinner in my GLP-1 patients, and the laxity decreases. This is all um, signs of decreased collagen. But so far, there's no study showing this, but then again, that's a study that's really hard to do. But it is well recognized by my dermatology and plastic surgery colleagues that this change in the skin quality does happen. Um, so we don't know why, but it is something that we can monitor.
Is that a good way to combat it, is through just taking like a supplement of there's a billion kinds of collagen and peptides out there now, I know. But kind of supplement your diet with that, or is there, should I be eating more kale? Should I be like, things like that?
So supplementing with collagen, the jury is still out whether or not that makes a difference. There's some studies that show yes, it does, and then there's some studies that show maybe it doesn't. So we don't really know. So there's no harm in taking collagen supplements. But I would say dietary wise, focus on the protein and focus on the healthy fats. But your skin, like it's external, so skincare is going to be important, and you can keep up with devices like radio frequency microneedling is a device that we have that can actually tightens the skin but also helps build new collagen. And I had a patient who lost 100 pounds in the span of 3 months from
What?
Ozempic.
What?
Crazy. Yeah, insane.
Okay, I haven't done that. My weight
But-
loss has been very, gradual, I think.
Good.
Fast, but gradual.
Yes and no, but I mean, 100
100
pounds.
pounds in
Yeah.
3 months.
It was too fast, and she came at the end of that massive weight change, and she had a lot of skin laxity on her face, but also in her arms and on her legs as well. And she was, what can we do? But unfortunately, when we have that much, like a significant amount, like 100 pounds minus amount of skin laxity, um, there's not much we can do that's non-invasive. So unfortunately, I had to send her to plastic surgery. But what you could do is when you start to notice it, do these devices and treatments that will help support the collagen, tighten the skin. So while you're losing the weight, you're being able to keep up with that collagen change.
Yeah, that's what I was going to
Wow.
ask you. Like, is it,
Yeah.
would it behoove people to do these things as they're losing the weight? Like get the fillers or do the,
Right.
before you have like such a big volume loss.
Right.
Yeah.
I mean, I'm not losing weight and I just want to get fillers.
Yeah, so another thing that can happen when you lose a lot of weight quickly is not only are you losing fat, but you're also losing muscle. And the reason that it gets harder and harder to lose weight as we get older is because we're losing muscle. So when you're accelerating that loss of muscle, that means once you're off the GLP-1, your metabolism isn't there from the muscles. So it's going to be a lot harder to stay at that weight.
Yeah.
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 All right. Well, let's get into some
Okay, other things.
other
I
fun
know.
topics. We
Yeah.
wanted to talk about some of these like DIY trends and things people are like, showing on TikTok and, all these different, I guess, trendy type, skincare things. You know,
guess.
I will try anything.
She'll try anything.
I really will try
nothing.
anything.
I try nothing. She tries everything.
I will try everything.
Yeah.
And so lately I've been looking at some of the stuff and I have not tried these. So I wanted to get your take on what you think about some of these things, like the oil pulling and the what was the other one I saw? Beef tallow was another
God.
one.
Yeah.
Like all these raw ingredient type things. Like first of all, how do you feel about those? And how can people kind of differentiate between trends that are really beneficial and some that could actually be harmful?
And so oil pulling, that's something that's been around for years. It's a Ayurvedic kind of normal day, like something you do every single day, where you swallow or not swallow, you take in about a tablespoon of coconut oil, then you swish it in your mouth for about 5 to 10 minutes, and then spit it out into your trash can because it can clog your sink. So don't.
Okay.
Yes,
It's,
yeah. I knew that actually.
and what it's supposed to do is take all the bacteria, everything that's coating your gums and teeth, and remove it, suck it out into the oil. There's no harm in doing this. As far as the evidence, this is something that's hard to study. But when I do oil pulling, my mouth feels fresher, it feels healthier, it feels cleaner. So this is something I would say go ahead, do it. There's no harm.
Okay.
Beef tallow. The reason beef tallow is being used on the skin is because people have realized that beef tallow has the same consistency as sebum, the oil produced by our pores. So they say, oh, if I have dry skin, this will help. The issue is it's just like the oil from our pores. So it'll clog your pores, it'll lead to acne. And because it's an unregulated ingredient, there's no preservatives or anything that's keeping it shelf stable. So people are buying beef tallow and it's going bad, it's going rancid, it's getting filled with bacteria.
Oh, God.
So this is not something I recommend.
Okay.
Oh, God.
All right. There's another one I saw that I was about to try actually.
Yeah, I can't wait to hear this.
It was a banana peel facial.
I know that. What is
so
that?
that you take banana peel and it's supposed to like brighten and tighten your skin like a natural Botox. So they would take the banana peel and you'd open it up and you'd rub it on your face.
Okay.
I mean, I would try that.
Totally.
And
would.
it smells
And it smells
good.
good.
It smells good.
It smells like banana.
Is there anything to that? I mean, I know there's antioxidants and lutein and things like that in the banana peel, but are there high enough concentrations to even have any significant effects on your skin?
So this is actually also something that's been done for years, but not in the Ayurvedic culture, but in the Japanese culture.
Oh, okay.
But it's not, unfortunately, I wish it's not a natural Botox. But there is a lot of there is a lot of vitamin C in bananas, and so putting on your face, you will see it's like putting vitamin C serum on your face. So not as you won't get as an effect that big of an effect, but the antioxidants, the other nutrients. So you'll see like maybe your skin will be like a little bit more glowy. I wouldn't put it on your skin for too long because it can irritate your skin. But again, no harm in doing this.
Okay.
Right.
All right. Well, we're
Yeah,
gonna
Wow.
break out
but
some
keep your
bananas later.
expectations
I know.
level.
Keep them low.
Okay.
Keep them low.
Okay. Okay. What about this one is gross. Salmon sperm injections. Have you heard of this?
Yes.
Okay.
Um,
I need to know more.
So there is some legitimacy. So there's the component in salmon sperm. It's called spermidine, and it is actually anti-aging. It actually does help with like fine lines, wrinkles. There's a lot of kind of funky, like they sound kind of funky, like snail mucin,
Yes.
salmon
Yes.
sperm.
Yes.
But these things actually do work, and it is something that's practiced in med spas and dermatology offices.
Wow.
Yeah. How do you get the sperm from salmon?
I know.
That I don't know.
I don't know. Swim upstream.
All right. So that's not no harm
I
there.
know.
All right. What other ones did we? The
There was
beef tallow we talked about.
The egg white
the egg white
mask?
mask. Yeah, that I've actually done that before.
You have?
Yeah. I feel like that one's been around a while. You like whisk the egg
Yeah.
whites, they get all foamy, and
Like
then
a
you put
meringue?
it kind of like a meringue, and
Yeah.
it feels. I mean, I don't know if it's doing anything, but it feels like your skin is tightening.
Oh.
I don't know.
Is there
So I
truth
would
to that?
actually be wary of that.
Okay.
Raw eggs, you do have a risk of getting salmonella.
Oh.
Um, yeah. So I mean, it's not like every egg has salmonella, but you don't know which ones might. So I would just be a little bit careful about raw eggs.
Okay. And it's
Wow.
also very expensive right now to do an egg white mask.
I was going to say the price of eggs.
I'd rather just go
I
and
know.
get some filler or Botox
Exactly.
or something. Are there any that are out there that you can think of that are
That work?
that really work?
So a lot of the more the trends that are more based in like holistic cultures, like the Ayurvedic, Japanese, like the oil pulling. So another one that works really well is something called abhyanga. Have you heard that one?
No.
Where you warm up oil and then you just kind of slather it all over your body in the morning, sit for 5 to 10 minutes, and then rinse it off. And it's a similar concept in Ayurveda to the oil pulling, where it's drawing out the toxins, but it's drawing out the toxins from your skin.
Wow.
Wow.
Is it any kind of oil or like?
So it depends on your energetic makeup. So for somebody who is, we call it like pitta dosha, which is they run a little bit hot, coconut oil is good, but you don't want to put it on the face because that could cause acne. For somebody who runs more like air energy, someone who is vata, who's more like creative, on the go all the time, you want something more grounding, so sesame oil.
Oh.
Oh, okay.
Yeah.
That's me. I'm
Wow.
Vata.
Yeah. What was I?
Uh,
I don't remember.
I don't remember what you were. We had gosh, a while
A
ago,
long
over a
time
year
ago,
ago,
yeah.
we had an Ayurvedic
And we talked about, we took the
amazing.
test to
we
see
took
what
the
our
test, and I
doshas
was
are.
very air, very
Yes.
Vata. I needed grounding. I need
Yes.
grounding in a
I
lot
was
of
very
areas in
I
my
was
life.
very grounded, I think.
I think you were too.
Yeah.
I don't remember what you are. What you were.
Oh, and then slugging. Slugging is
Oh.
another
Oh,
trend.
yes, I know.
Where you put petroleum jelly on your face at night. So this is actually good for that dry, sensitive skin, but you want to avoid if you have oily or acne-prone skin because it can
Right.
also clog your pores.
Okay.
And then you just rinse it off in the morning when you do that? I wonder if I should
So
do that. My face is
it's something
my
I
skin
do
is so
actually
dry.
You
because my
do?
skin is
Yeah.
so dry.
I'll do
Wow.
anything that you
No.
do. Your skin is amazing.
I know. You can tell.
I
Like,
think I need
through
a
the
time
screen.
machine. I need a time machine for her skin, though.
Yeah.
No, it just absorbs. So when you wake up, it's
Right.
Yeah.
gone.
I guess
Yeah.
the more dry, I have
Right.
very dry
Yeah.
skin. So anytime I
do
put
too.
anything on it,
Same.
just feel like it sucks it right
That's
up.
the way I feel.
Yeah.
You know?
Yeah. So what about different ingredients? And we talked a little bit about like topical skincare and things for eczema. And are there specific ingredients that are that shouldn't be mixed together, or some that are more, obviously there's some that are more effective than others,
Right.
but what about mixing? I'm always worried that because I do use a retinol and I use a vitamin C and I kind of switch it up all the time, but I'm always wondering, am I getting any benefit? Am I, what's the deal with that?
Yeah.
Yeah, so both of those are great skincare products. Retinol, they've done studies and they found that people who used retinoids for 12 months, they had a 30% reduction in wrinkles, which is amazing.
Oh, wow.
That's why retinoids are kind of like the gold standard in dermatology for anti-aging. And vitamin C is great. It brightens your skin and it also gives, because of the antioxidant, a layer of protection from UV radiation. So I like to do vitamin C in the morning and retinoids at night. Um, Totally fine to use both of them. What you don't want to mix are you want to focus on skincare ingredients that can irritate the skin. So retinoid with an AHA or BHA, like glycolic acid, that's too harsh and that will irritate the skin and make your skin more sensitive. And then retinols with benzoyl peroxide. Benzoyl peroxide will actually oxidize retinol, so it won't work. So those are, I would say, the big two to stay away from.
Okay. Interesting.
Wow.
Yeah.
Yeah.
Yeah. Are there any like, I mean, again, I try everything and I'll use anything.
Anything.
But are there like how do some of those ingredients like the retinoids and the peptides and antioxidants, how do they compare in their like long-term effects?
So retinoids, you'll start to see a noticeable difference in your skin in just a month. If it's a prescription retinoid, if it's something over the counter, it might take about 3 months to see the difference. Because the over the counter retinol has to be converted to retinoic acid in the body versus the prescription is straight retinoic acid.
Got it. Okay.
So long-term effects, like I said, 30% decrease in wrinkles in 12 months. And then peptides, which are short amino acid chains that tell your body to make more collagen. Um, it takes longer to see the effect. But the real magic of peptides is to stop the progression of collagen loss. Um,
Okay.
Oh.
Okay. When you're putting these different things on your face, is there, I mean, you mentioned like you do vitamin C in the morning and do retinoid at night. What about like layering things? How does that work? And I'm assuming the first thing you put on is going to be the most absorbed into your skin,
Right.
right? But what about layering different products?
So the steps I like to say is first clean your face. And then if you have oily skin, then the second step would be a toner. And then like just like you said, the most the most powerful things you want to absorb the most. So that's all your actives. So any serum, vitamin C, AHAs, BHAs, niacinamide, followed by a moisturizer, followed by a sunscreen.
Okay.
Wow.
And then
Okay.
in terms of what to go first of the actives, you want to do like the thinnest to the thickest. Because otherwise, if you put on the thickest first,
It'll
then it
block
won't
the
let
other stuff.
the thinner. Yeah,
Sure.
exactly.
Okay.
Sure.
Okay. I usually do a serum first. Well, I do. So, what about exfoliating? Like with dry skin, especially, I'm always worried. Like, I feel like when I exfoliate and then I put on the serum again, like I feel that absorption. But should I not be
Mm.
exfoliating because my skin is so dry?
So everybody should be exfoliating.
Okay.
Exfoliating, especially people with dry skin, because dry skin, the dead skin cells tend to kind of build up on the skin, and you need to get that to come off, so your serums can absorb better. But if you have dry skin, you want to do maybe like once a week. If you have oily skin, you can do like 2 or 3 times a week.
Okay.
Does it matter if you're doing these things in the morning or the night, or you're doing them both in the morning and the night?
So in general, I like to say in the morning, your skincare should be to protect your skin. So sunscreen, vitamin C, antioxidants. And at night, it should be to repair your skin. So exfoliating agents or retinoids, um,
Before you
growth
go to sleep.
factors, peptides.
Yeah.
Okay. And peptides, I mean, is there a difference between topical? I mean, I know there's a difference between topical and injectable, but do they have different effects?
So when you're doing peptides topically, like other proteins, like let's say amino exosomes and stem cells, this is more to help your skin heal. So I like to use this especially when I do microneedling or a laser treatment to put on right after to help your downtime be a lot quicker. Or if I'm doing a hair procedure, then I can inject it, and the peptides or growth factors will actually help stimulate new hair growth. But then uh, putting as like skincare, um, like every day, this will help just kind of slowly increase the amount of collagen.
Wow.
Okay. Okay. I do use exosomes. I use like I use it every day. Should I not be using that every day?
I don't even know what
It
that is.
depends on how your skin's taking it.
Yeah.
If your
Okay.
skin is fine, it's not feeling irritated or dry,
Yeah.
then that's fine.
Yeah, it doesn't feel, I mean, it's very thin.
Mhm.
I like how it feels. I don't like how it smells, but I like how it feels on my skin. But the peptides I've never tried,
Yeah.
and I've always been curious about like injectable peptides, you know.
Of course you are.
Yeah.
Anything you can inject into
Anything
your
I can
skin.
inject.
Love an injection.
I do. I do.
So what would you say, just to like wrap up, what would be the top 3 things that are the most important to remember to maintain your skin, especially as you age?
Yeah, so I would say number one is when we're talking about diet, is decreasing the amount of sugar, processed foods, and increasing the amount of uh, like leafy greens, fruits, vegetables. Also, we didn't really talk about it much, but eating foods that will directly support your gut. So fermented foods, probiotic, prebiotic foods, that's important. And then having a being consistent with a good skincare routine. So everyone needs a cleanser, sunscreen, moisturizer, and then they kind of like extra credit is the retinoids, the vitamin C, the peptides. And then also your lifestyle makes a big difference too. Stress reduction, exercise, all of these will help increase blood flow in your body and your skin. And exercise has been actually shown, as specifically resistance training, to slow down the rate of aging.
Yeah.
Hmm. The one thing just about exercise for a quick second, you know, I was a runner for a long time and they always talked about, oxidative stress. And I'm like, well, how do it's like, I want to run, but I also don't want to have wrinkles. So it's like, it's such a catch-22 to me.
Wow.
I think
Especially you.
right. Like the
Yeah.
strength training makes sense. It's like, I'll strength train forever, but I worry sometimes about like the cardiovascular exercise and all of those like free radicals. Do you have any like advice about that?
Yeah, so for inflammation, oxidative stress, diet plays a really big role here. So eating those omega-3 fatty acids to decrease the inflammation, but then for the oxidative stress, uh, polyphenols and flavonoids, like berries, green tea, oolong tea, all of these things have different polyphenols that will help bring down the oxidative stress.
Okay. All right.
Wow.
So I would aim for like 3 to 5 different polyphenols a day.
Okay. I can do that.
Wow. Yeah.
Not that I run so
I
much
know.
anymore, but just to, even just being out in the
I know.
environment and all the
Right.
things that we're exposed to, all the pollutants and all the things that we're exposed
Yeah.
to in the environment that like, I feel like just dull our skin,
Yeah,
But
definitely.
this was so great. Thank you so much.
Thanks
This
for
was
being
Yeah,
awesome.
of
here.
course. Thank you.
Is there anything else that you want to mention or anything that we might have missed?
Um, no, I think that's
All
all.
right. How can people find you?
You can find me on social media, Instagram, TikTok, YouTube. At my username is at Dr. Asmi Berry.
Okay.
Well,
Awesome.
thank you very much for being here, Dr. Berry. On Every.body
Thank
Talks. I
you.
appreciate it. You know what I realized while we were talking to her
Yes.
is that I really haven't had a skincare routine since I was like in high school.
When it's the most important
I
to
know.
have now.
Now I have
Although I
one
shouldn't say that.
now.
When you're younger, it is important too.
But
I think.
like all I kept thinking was that my mom and my grandmother, and I think I've talked about this before, going to Georgette Klinger.
Oh my God! Yes,
And
yes.
we would go for facials and we would come home with like the billion products that I would religiously do every night.
And now you do nothing.
And now I do nothing. Well, now I don't. I mean, thanks to going to a dermatologist and all of these problems that I've had of late.
Right? Yeah.
I do take care.
I did want to ask her that actually. I'm surprised
Yeah.
you didn't. Like when we're talking about the
Yeah.
GLP-1s, are those triggers for all like some of these things that you've been getting?
The only reason I think not is because I have
You had them before. But you've had them a lot more frequently since. Don't you think, or no?
No.
No? Okay. I don't know.
I feel like things have just like amped up.
Yeah.
But I mean, I think I've taken the steps. I know you hate like I'm injecting myself with all these things.
All these things. I
have
can't
a lot
take
of things
it.
I'm taking in, but I just, yeah. I mean,
I'd like you to try some of the stuff that she mentioned.
well, I
and
need to buy oolong tea.
oolong tea. I think
I need to go back and get whatever
the
that
prebiotic or the
yeah.
whatever she talked about
Yeah.
for. Yeah, it was a prebiotic. I think.
Prebiotic, I think. Yeah. But you who try everything, like you were talking about things, and I was like, I don't know what that is. Don't know what that is. I don't know what that is when you're like oxidative stress. I was like, I don't know what that is.
Well, that was always a thing. Like,
what does that mean?
so oxidative stress, what happens is when you are exercising, let's say, right? Your body is releasing free radicals, and you want to be able to,
Right.
so antioxidants, right? You know what antioxidants
Yes,
are,
I know.
right? So that combats oxidative stress. So when you're out in the environment or you're exposed to any kind of like pollution or regular just stress, your body releases these free radicals, and you want to be able to not have that happen because it ages you.
Right.
It does a lot of other things too, but breaking down collagen. And so that was my, always my thing. It's like, oh, I love to run, but I'm going to look old if I keep running.
Oh, that's funny. I mean, it is funny that I did nothing. Everyone always tells me how young I look, which I think is also attributed to other things in my lifestyle. But it's like I was like, oh, I'm not washing my face because I look young. So what do I have to do anything for? And now,
wait. So what's your? All right.
Oh my God.
Let's break this down for a second.
No.
So at night, before you go to bed, you brush your teeth.
I brush my teeth,
and then what?
Well, I wash my face now.
What do you wash it with?
With this Vanna cream cleanser that Dr. Day recommended because it's very
mild.
It's very it's
for sensitive skin.
Yes, it's for sensitive. I couldn't think of the word sensitive, but yeah, it's for sensitive skin. I washed that, and then I was using this BioJuve, which Dr. Day also gave me, which I don't love, but it's kind of like I don't know what it does, but it's like a serum-y spray thing.
All right.
And now lately, because it's so dry and I've been having all of this eczema, which I'm hoping is going to go away, I use Vanna Cream has a facial moisturizer. So I kind of stopped using the
So you have a
BioJuice.
routine.
I have a routine now.
But you never
I've
did.
had for the past 6 months.
Oh, okay.
To a year.
Prior to that.
I don't know when, I would say like past 6 months. And then I also now put on all of the prescriptive creams that I have for the eczema, which is Opsilora, which I think is a miracle cream.
That's the one Dr. Day
That's the one that
gives
Dr.
you.
gave me, and also Zorive, which is also, and then I have like different gradations of things depending on how bad things are. But Opsilora really, and I know other people who have eczema, and that really is
and eczema is autoimmune.
Yeah, it's an autoimmune disease. Yeah,
because my dad had psoriasis.
Which is also autoimmune. They're related. I think they're related.
Yeah.
It's weird to have eczema because David, my ex-husband had eczema, and it always flared up at certain times. And I definitely, when I'm nervous, when
stress.
I'm uncomfortable, any stress, and I think you notice it now, like
you're scratching. Yeah.
You're
like a puppy.
I am like a puppy. There you go. So, but what's your skincare routine? You have 100 serums and potions that you do. And you have a different one. Like in the morning, I do nothing.
Oh, really?
Yeah.
What about sunscreen?
Oh, God, no. I know.
That's terrible.
I know.
I have a different routine in the morning than I do at night. And also now that I'm back and forth between the city and here, I have different products in different places. So,
but don't you feel like you should narrow it down to just like the one?
Well,
like one or two things that you do in both places? And isn't that kind of consistency?
Yes.
Well,
I do the same things just with different products. It's like the same
product,
basic
essentially.
ingredients.
Oh, okay.
Yeah. The exosomes.
I don't know what that is. What is an exosome?
It's for like cell repair.
Oh,
like it helps.
Okay.
So Dr. Day has been doing like this research on exosomes and obviously stem cells and all that stuff. It's a little bit more extreme, but she gave me this lotion, this exosome lotion that I use. I do that in the morning and at night.
Yeah.
Super, super thin. And then I put a serum over that. But like the more, like she was saying, you don't want to,
It's like at some point, it's like, that's the thing. Like if I have a flare up, I'll put everything on because I think one of these things is going to help me. You know?
Meanwhile, you should be like trying to prevent it from even happening in the first place, right?
Well, I'm trying to do that.
Okay. Well,
Okay.
we're all about
Well, here we go.
prevention and root cause here.
Perhaps. Well, I'm trying to get to the root cause. I think you know that.
I know, but I don't like all these like prescriptions.
I know, but okay.
Just saying.
I know.
Looking out for you.
But it's like
A lot of injectables that aren't Botox. Meanwhile, I
know.
inject poison into my
I was gonna
face.
say, you put like bacteria into your face to paralyze it. So there you go. So we hope this has given you some food for thought, serum for thought.
It's a toxin.
Right. Well, isn't it a bacteria?
Anyway.
Isn't Botox a bacteria?
No, botulism toxin.
Botulism. Okay. Splitting hairs there. Anyway, we hope this gave you some food for thought and think about what your morning routine is.
Yeah, I want to know.
Yeah, exactly. So let us know. And I'm Laura Schulweis.
And I'm Jen Giamo.
And this was another episode of Everybody Talks.
Talk to you next time. For more information about our podcast, to learn more about us, and to catch up on all of our episodes, go to our website at everybodytalkspodcast.com.
Follow us on Instagram at Shuli, at Jen Giamo, and at Everybody Talks. And if you want to watch today's episode, go to our YouTube channel at Everybody Talks Podcast.
Join the Everybody Talks community by checking out our Patreon page, where you can become an exclusive member of our wellness group and be a part of the conversation.
And don't forget, if you like what you've heard, give us a 5-star rating, write a review, and tell a friend. We're for everybody and everybody. The Everybody Talks podcast is co-created, executive produced, and hosted by us, Lori Schulweis and Jen Giamo. Produced and edited by Station 16.
Our theme song music is written and performed by Jackie Ryle and Aaron Navisi, with additional support from our pups, Oliver, Milo, and Murray.
Talk to you next time.